We have to understand that stress is a normal phenomenon. We all get stressed in front of challenges and adversities in life. 17% of stress is useful. Unless you have a stress, you can't really succeed. So stress is not bad. What is difficult when the chronic stress happens? The stress happens acutely, it builds up, and our body and mind get adapted to it. But if it is a chronic, then we get burnout. And especially for the kids with autism and parents have that called caregivers burden or burnout. When we face challenges, we feel inadequate, we blame ourselves, we fail, then it is highly important to be your own best friend. Tune in with your suffering. You need to take care of yourself before you can take care of your kid. It's called mindful self-compassion. It's tuning in with you empathically with your own suffering.
Hello and welcome to another episode of the India Autism Center podcast, a space where we talk about autism with honesty, care, and hope. I'm your host Sadamini, and today's episode is what many parents and caregivers go through almost every day: stress. Not the small kind of stress, but the one that builds up silently, affecting sleep, patience, and peace of mind. Today we are joined by Dr. Amit Biswas, a consultant, child and adolescent neuropsychiatrist based in London with 25 years of experience in the specialist fields, both nationally and internationally. Welcome, sir. We're so happy to have you with us here.
I'm absolutely honored and privileged to be here. Thank you for inviting me.
Let us begin with a question we often hear from parents. How can one effectively manage their own anxiety or stress while caring for an autistic child? When a parent is already feeling overwhelmed by sensory demands, noise, touch, constant stress, how does one balance personal well-being with the responsibilities of parenting?
This is a huge question.
Yeah.
I will answer in parts. Firstly, we have to understand what is stress, especially for the parents with children of autism spectrum disorder or developmental disability. And then there is well-being, which is a huge concept.
Yes.
So we have to understand that stress is a normal phenomenon. We all get stressed in front of challenges and adversities in life. Stress means our body reacts, our mind reacts with stress, but also internally neurochemicals that makes us 17% of stress is useful. Unless you have a stress, you can't really succeed. There's a beautiful book called Upside of Stress. So stress is not bad. What is difficult when the chronic stress happens? The stress happens acutely, it builds up, and our body and mind get adapted to it. But if it is a chronic, then we get burnout.
Right.
And especially for the kids with autism and parents have that called caregivers burden or burnout, which is very difficult.
Yeah.
Now, there are many ways what we call is a stress resilience and management.
Right.
On a daily basis and over time, we have to build up our internal muscles, because what happens in front of when we get stressed, our cognitive means intellectual, emotional, and all other resources, physical resources gets overwhelmed.
Right.
So when we are overwhelmed and we can't manage, we get stress. The word is resilience. How can we be stress resilient? Is one of the pillars of lifestyle medicine.
Right.
The management of stress. Now, resilience also is an important word to understand. It's not about navigating through the adversities, which parents should be doing. It's about bouncing back, having a growth mindset. We call it post-traumatic growth.
Yeah.
Understanding stress is important. Cultivating the ways to resilient is important, and there are ways, absolutely evidence-based ways how to be resilient. And I'm going to talk about that. Another thing is, you just said well-being, which is very misunderstood term. Now, well-being can be physical well-being, mental health well-being, even financial well-being, emotional well-being, and spiritual well-being. So when we look into various domains, we have to know, like physical, what do you mean? Three things, very simply. And we have to monitor. Three things means, are we looking after our body?
Yeah.
Means, are we exercising 20 minutes per day? You don't have to do hundreds of hours of resilient training. Number two, are we sleeping well? It's vital, not just for your rest. Sleep, metabolism, and everything is very, very important. Are we looking after our mind? That means, are we calm? Are we still? Are we curious? Are we learning? Are we sharing? This is looking after the body.
Yeah.
Then looking after the, sorry, I forgot one thing. It's about exercise, food, that means nutrition.
Yep.
It's highly important, especially for the kids. Because nutrition is so vital. We have to really be careful about what the kids are eating. Like, very simply, a child having a very high sugar diet can have hyperactivities.
Right.
And that can be unmanageable. So nutrition, sleep, exercise. Then about mind, how to be more resilient, and then emotional kind of thing. Now, so well-being is a concept, means you can build this up over time to have a sense of well-being that always carried with you, no matter what in front of the adversities. What makes us happy? That's the question. Well-being means happy.
Right.
The evidence-based ways to make yourself happy is several. Like, I'll give you the foresight studies of 4,000 people. Number one, gratitude and giving. I have a mnemonic. It's called GREAT, G-R-E-A-T, gratitude and giving. The second one is very important, and I will tell everybody to do this, are relationships.
Right.
The most important thing that makes us happy is meaningful, positive relationships. That's why Costa Rica or Scandinavia is the happiest countries in the world. Positive, connecting, meaningful relationship. That we call social capital, GR. E, exercise, we just said.
Yeah.
A, being curious and active, doing things that matters to them, meaningful. And T is taking notice, mindfulness. This is about mindful parenting, tuning with our children, but also meditations, keeping yourself still, being ready. There are good evidence that mindful meditations build our internal resilience muscles.
Right.
So in front of stress, we relate to things differently. We make the challenges, we can resiliently move through, navigate through challenges while we are calm. So we don't react to situations every day. We respond with calmness.
Yeah.
So there is a huge amount of research that has done how to manage stress. I can talk for hours. This is called self-mastery. So especially for kids with autism and their parents, what I would like to do, we firstly have to do, what is this going on? Because they are confused.
Yeah.
Apart from what I just spoken, is general stress management.
Yes.
But for kids with autism, what is going on? Say a kid's having a meltdown.
Yeah.
So I have to understand why this kid has behavioral challenges and meltdown.
Yeah.
So I have to have a clarity. Not every kids with autism have a meltdown. Is he anxious? Does he have ADHD? And we do know 60% with kids with ASD, autistic spectrum condition, also have ADHD.
Right.
Have we diagnosed ADHD? Have we treated ADHD? High number of children with autism spectrum have sensory difficulties.
Yeah.
Have their sensory needs are met. Somebody going to a noisy environment and actually shouting and closing their ears. Some people are sensory avoiding. Some people are sensory seeking.
Multiple triggers for that.
So I have to understand behaviorally, and there are approaches like positive behavioral support, PBS,
Right.
to understand for the specific need of the person and how to address those behaviors, because behaviors are something that challenges and meltdowns happens, family disruptions happens, but many other factors. Say somebody who is not speaking And sometimes, yes, at developmental, it's a very challenge because the communication is not there.
Yeah.
The social reciprocity is not there. So I have to understand, how can I improve the situations by speech and language therapy? What is needed? What is needed is occupational therapy. Somebody is not able to write. How can I support that? Somebody have a spelling problem. Because autism is not an isolated developmental condition.
Yeah.
It comes with comorbidities.
Comorbidities.
Means generally it comes with sensory difficulties, repetitive behaviors. It comes with a huge number of other developmental challenges such as intellectual disability.
Yes.
So clarity is very important from the professional, what is going on. And treating and addressing those needs helps the parents. Apart from those general things I said about stress, about self-awareness, mindfulness, gratefulness, giving, tuning in. But the most important thing I would say, and this changes people's life, self-compassion. It's an evidence-based way of being your best friend. What happens is a work from Kirsten Neff and Chris Germer. And I would like the audience to look into the website of selfcompassion.org because I won't be able to finish. It's about when we face challenges, we feel inadequate, we blame ourselves, we fail, then it is highly important to be your own best friend.
Right.
Treating yourself with love and care as we do for your friend.
For a friend, yes.
And it's not a gesture of goodwill. It's called mindful self-compassion. It's tuning in with you empathically with your own suffering. Number one, there's 3 doorways. So that I understand I am suffering. This is a difficult time right now.
Yeah.
The second thing is I am not the only one. It's common humanity because we tend to isolate ourselves when we suffer.
Yeah.
So the message for the parents is, number one, tune in with your suffering. You need to take care of yourself before you can take care of your kid. You cannot take care of your kid if you do simple things like pedicures, going for a walk, taking a break. So third is doing something about it, as I said.
Yeah.
Be mindfully tuning in, and there are practices, self-compassion journal, self-compassion letters, self-compassion break, many evidence-based ways how to be more kind to ourselves. That is the first thing I would say for stress management. It builds up resilience. It changes actually hormones. It makes us immunity higher. So these are some ways to be resilient, manage stress, and especially kids with autism.
Before we continue, here's a quick look at who we are at the India Autism Center.
Imagine a space designed not just to care for individuals with autism, but to empower them. A place where knowledge grows, support flourishes, and possibilities expand. This is India Autism Center. It is built to redefine how we approach autism. Through education, research, and community-driven initiatives, we create an environment where individuals with autism can thrive. Samavesh, our residential campus, is designed for individuals with autism to live, learn, and grow with dignity and independence. It is more than just a place to stay. It is a space to belong. Manan, our training academy, prepares professionals to provide specialized care. Through structured programs, we equip individuals with the skills to support neurodivergent communities with confidence and compassion. Khoj, our research division, is dedicated to advancing our understanding of autism. Through data-driven studies and collaborative research, we work towards shaping the future of neurodiversity.
When emotional dysregulation becomes a daily challenge, how can parents safeguard themselves against burnout while continuing to remain emotionally connected and present for their child?
Yes. And that's a brilliant question. And I think I have also answered in the first bit.
Yeah.
Firstly, what is emotional dysregulation? It's not a diagnosis.
Yeah.
It's a DSM have included a little bit of that, but emotional dysregulation is very simply meltdown. It's a behavior. So we, as I said, we have to understand why the meltdown's happening. And there are ways, what we call functional analysis, ABC. Antecedent, what is happening before the behavior? Somebody hearing a shrill noise, or somebody not going to school on the same way the person is going, because the children with autism want routine, structure, and predictability.
Yes.
So we have to know what's the antecedent, what the exact behavior is like, and then what happens afterwards. Some parents unconsciously or inadvertently reinforce the behaviors by paying negative attention. Okay. So analysis of the behavior and approaching the child to manage the behavior is the first thing. However, it is difficult for parents. Some people feel also, I can't do it anymore, I'm burnt out. And they feel guilt, not able to give time, not able to manage, because they have other things. They have mother-in-laws, father-in-laws, they have their work, many other things. So they get overwhelmed.
Yeah.
So one of the things to approach this, how to again be self-compassion, and not that I'm the only one, and how to make priorities one after another, how to be clear what is going on, how can I address this, rather than just giving up, blaming themselves that I'm a bad parent, which happens quite a lot. Because there is a stigma around autism or mental health.
Yeah.
And that understanding, some people say I have done something in my past life that I have got a kid like this. It's really important. It's highly genetic disorder, 98% heritability. At the same time, it's not your fault. It's not one gene. It's a multiple gene working together. We have a kid. And it's a very common condition. When I was getting trained in ages ago, and there was 1 in 10,000. Then we taught nationally, internationally, we trained people, and now it is about 1 in 200, and some people 1 in 60. So it's a common condition. It's a lifelong condition. Accepting it is what it is really important, but addressing the important issues that going on, clarity, what this kid had, and professional's job. I have seen here doing diagnosis, or not here, it's a lot of other places. It's diagnosis has to be clear. It's not that kid have not speaking means autism.
Yeah.
It has to be a rigorous, thorough process of developmental assessment.
Right.
We cannot do autism diagnosis by giving a screening questionnaires. So diagnosis is clear, comorbidity is clear. So I know, the parents has to know, autism is not treated by medical ways.
Right.
We only treat the medicals when there is an anxiety disorder, depressive illness. When there is a meltdown, we have to know what the needs of the autism is not met. What is the comorbid need is not met.
Yeah.
Educational need, behavioral need, social need, occupational needs, therapeutic one-to-one need. What is not met? Why is this meltdown happening? Then looking after yourself, taking time out. It's really important without guilt.
Yes.
Looking after simple things in life, even going to cinema and not feeling that I ignored my child. You have to look after yourself. You have to build friendships, as I said, positive relationships. And it's highly important for parents to have a support group. So we share our thing. I am not the only one. We share, and sometimes we get really good cues how to manage this. Say just few days ago, one mother was saying, you know what, I use weighted blanket at home at night and this person sleeps well rather than giving medication. Other person picks it up. So this is important to be solidarity together, knowing it is a common condition and we will be there.
It helps you gain perspective.
Yes, perspective, having a hope. It's an internationally, everywhere there is autism. We diagnosing it more, but also we are over-diagnosing it. Because everybody becoming a specialist. No, even just yesterday somebody says, occupational therapist told me, most people need to be trained in autism diagnosis.
Right.
There is ways, like I do DISCO, Developmental Assessment of Social Communication Disorder, alongside ADOS. ADOS means is Autism Diagnostic Observation Schedule. ADOS with the kid and developmental assessment, then observation, then school reports, then speech and language therapy reports, psychology reports.
Right.
It's a very important process to be clarity. Most parents suffer when they do not have clarity.
Yep.
Okay, so I will stop.
That just adds on to the stress when you don't have clarity.
Absolutely.
For sure. Why are children with ASD often more vulnerable to anxiety, depression, and self-harm compared to those with other neurodevelopmental conditions. Additionally, what underlying neurological or sensory factors may be contributing to recurring emotional outbursts in autistic children?
Again, this the question. This can be talked for hours. So I will firstly say, autism. We don't say disorder anymore. Autism spectrum condition, to get away from stigma.
Right.
It's a condition. It's not a mental health disorder. It's a developmental condition. Now, autism is a genetic condition which comes with vulnerabilities of young people can be more anxious or more likely to have mental health disorders compared to their counterpart of neurotypical one. That's their genetic vulnerability, biological. But there are social vulnerability and there are systemic. Social is also systemic, but what we call biological, psychological vulnerability and social vulnerability. Now, what is social? Say somebody is not able to speak, okay, and or have a lisp. He's vulnerable to other people having bullying. Bullying destroys lives.
Right.
This is trauma. Now, we have a concept called ACE, childhood events, the childhood trauma, and children with autism get more traumatized because of their vulnerability.
Exactly.
Say somebody having a tapping because of repetitive behavior, or smelling something or touching something, and that being picked up, the teachers doesn't understand that. So the awareness is so important in every system, the home system, the school system, the outside general public system. I remember a kid who doesn't have a voice and really restless, have ADHD, gone on the street and the mother has been told, "Pagol bachcha ke niye beriyechen keno?" So you see how the stigmatizing and how emotionally difficult for a mother to have that.
Right.
So the problem is, part is acceptance is a problem. The part is also they get traumatized, and not autism, but there's trauma, the adverse childhood events.
Right.
They get really, and then when they don't understood, when their vulnerabilities are not addressed. I'll give an example. A kid with autism is sitting in a class with 30 people with highly socially anxious.
Yeah.
He has ADHD, so he cannot focus. Now he have a dyslexia, cannot read light. Then he is getting bullied. Think about, I'm sitting in a Chinese class almost, because I can't process information because I have receptive language problem. I don't have expressive language that much. So there are multiple levels of problems. So I'm failing educationally. My self-esteem is getting bruised. I am thinking I do not belong here. I don't have friends. I am stupid, although the cognitive level might be high.
Yeah.
So this creates a mental construct and low self-esteem. This goes into depression. When somebody cannot manage stress, they go into self-harm because there is no other way to express themselves. But self-harm can be habitual, can be even sensory, and they can go into the habitual mode and be reinforced by parents or others. Why are you doing self-harm? I know a person, young person from a very big school in Calcutta, being excluded from school for 3 months because of self-harm. So what are you doing to the child? You're destroying. And that person came to me depressed, highly suicidal. Because it's not about autism, how he's been treated, how society doesn't understand, how self-harm has to be understood and not addressed. Not everybody has self-harm is a psychiatric problem.
Right.
Doesn't need to come to us. It becomes complex when it is reinforced. Stop it. They cannot stop it. It's a coping strategy. So both parents and children has to know how to cope in front of stress.
There's a huge gap.
Yes. And the coping can be very simple, using ear defenders. A coping can be simple, have a fidget toys when somebody is ADHD, not always medication. The coping can be very simple, taking time out, having a sensory box. So these are the parents has to be understood what I need to do and prevent these mental health problems. I hope that briefly answers your question.
Yes, it does. It does. If you're watching this and finding it helpful, don't forget to hit the like button. Let us now turn to the practical realities of a parent's daily life. What are some everyday practices that can help reduce stress while caring for a person on the autism spectrum? Not formal therapeutic interventions, but simple, sustainable daily habits.
That's a fantastic question. Although I've sprinkled a little bit here and there, but I will tell you what I say to the parents is A, B, C, D, E, G, F. A is awareness. Awareness of how I feel and tuning in and bringing it out not in an explosive way. When we are aware of our thoughts of feeling I'm stressed and able to calm, we can tune in with the person in front of me. Awareness, acceptance. A is for acceptance. It is what it is right here, right now. That's mindful, powerful acceptance. The next moment will evolve. Third is creating awareness is also I'm only aware when I'm calm. So creating a morning routine such as 10 minutes of mindful meditation, tuning with your breath, be fully present wherever you are without judgment. Okay, 10 minutes. Mindset, positive affirmation. Today is going to be a good day. I'm getting better and better every day. I am not the only one. Positive affirmations. Mindset, meditation and movement. A little dance, little Hindi song and dance because you're moving or doing yoga, doing some exercise. Little half an hour morning routine. B, this is very important, breathing. There are various kinds of breathing that is really helps parents within, because what we're trying to do when we are stressed, our sympathetic nervous vagus nerve fires, adrenaline fires. But there is another vagus nerve branch called parasympathetic vagal tone.
Right.
Breathing and many other practices improves vagal tone. When improves parasympathetic, we are calm. Such as box breathing. Box means 4. In 4, stop 4, out 4, 4. There is Andrew Will kind of breathing 4, 7, 8. 4, 7 and 8. There are many other kinds of breathing. Alternate amader pranayama breathing.
Right.
Breathing is vital. It's improved parasympathetic tone. Or even chanting improves parasympathetic. Going to the toilet and having a splash of fresh water improves parasympathetic tone. But A, B, C, already said, compassion, self-compassion, looking after yourself, having pleasurable moments is really important to be happy and well-being. D, deep, intimate relationships. It's not just one-to-one relationship, having social connections. And when you are intimate, you don't have to have hundreds of friends. Few people that you deeply connect. E is exercise. I can't overemphasize it. Keeping your body fit means positive hormones are doing, and you don't have to just do whatever you can at home, jump around, brisk walk, 20 minutes, pumping happy hormones. That's really important. F, highly important, forest. Forest means nature.
Nature.
Connect to nature, and you don't have to go to Himalayas to connect to nature. Even really watering a plant and tuning with the plant is really important. This actually evidence where they release phytosense, they calms us, soothes us. Japanese do something called forest bath. It's really important to help our nerves soothe and important parasympathetic. And EFG is highly important. Attitude of gratitude, the gratefulness practices. There are many diaries I ask people to do. 21 days of gratitude practice. 3 things I'm grateful for today. It comes from positive psychology, changes brain. 3 things, despite all the stress. I have had a lovely coffee today and thank you for the barista. I have a lovely connection with you today. Thank you for inviting me here. I have a beautiful sunshine today. Thank you. So watching what is going good and be grateful.
Right.
Okay. So simple practices.
That's amazing. Thank you for that. As a caregiver, what should one do when they feel unable to cope with another meltdown? Does this indicate a lack of capability, or is this a common experience shared by many parents?
Okay. As I said earlier, that firstly, you have to build up your resilient muscles. If you not practice, if you're not mindful, if you're not compassionate, if you don't have your coping toolbox, this is important. I have this in toolbox. I have a list of 10 things when I cope. I will take a time out. I'll go and have a coffee, whatever it is. I have to be ready for the battle.
Yep.
The people go to the battle with armors on. Parents need to put the armors on. Still, with all the armors, it's highly difficult. It's highly difficult when some young person is screaming, meltdown. I have done everything I can. It's still happening. So, firstly, I have to ask professional help. And still happening. Why have to see what is going on in the system? And I have to say this, child protection and safeguarding is primary. I haven't said that before. I have done everything for my kid. The kid goes school or somewhere else and getting abused physically, sexually, or whatever. And then it is happening. I have to tune in what is going on. Safeguarding is the highest priority. And then I have to think about, I am not coping. I am not the only one. As I said, I am tuning in. I am not a failure. I am not beating down myself. I will do my best, but I, as a human, give yourself permission to be human. This is one of the things I will say to the parents. Give yourself permission to be human. You are a masterpiece and work in progress at the same time. Prognosis is autism is important. How parents know? Some people ask me, how is going to my child in 10 years time, 5 years time? First thing, I do not know. I cannot give false answers.
Right.
However, there are parameters when we know the prognosis is better. Number one, the language at age 4. Number 2, higher intellectual ability. We call higher functioning autism. We don't call Asperger's anymore. So cognitive better functioning, language at age 4, and adaptive functioning. How this person is adapting with social situations,
Right.
growing, learning. But the support is very important. So when I have given these supports, I've addressed the needs, of course the prognosis is better. So I will tell the parents, be hopeful, do your best, be human, know you are not the only one. So one step at one time. I would not throw myself too much in the future and get caught up, আমার ছেলেটা হবে কি, what am going to happen, when I'm going to die. It's too far. What I need to do right here, right now. And be hopeful.
Yes. That was truly insightful. Thank you so much, sir, for sharing your knowledge with us today. To our listeners, if today's episode helped you, please share it with someone who needs it. Until next time, watch this video pop up on your screen.